Aflibercept is a biopharmaceutical drug invented by Regeneron Pharmaceuticals, approved in the United States and Europe for the treatment of wet macular degeneration under the trade name EYNTK, and for metastatic colorectal cancer as Zaltrab. As the active ingredient of Zaltrab, the substance is called Aflibercept in the US. It is an inhibitor of vascular endothelial growth factor, VEGF. Aflibercept is being co-developed for cancer treatment by Sanofi and Regeneron under a deal signed in 2003, and is being co-developed for eye diseases by Bayer Healthcare and Regeneron under a deal signed in 2006. Composition: Aflibercept is a recombinant fusion protein consisting of vascular endothelial growth factor, VEGF, binding portions from the extracellular domains of human VEGF receptors 1 and 2, that are fused to the Fc portion of the human IgG1 immunoglobulin. Indications and administration: EYNTK, the formulation for the treatment of wet macular degeneration, is administered as an intravitreal injection, that is, into the eye. Zaltrab, for cancer treatment, is given intravenously in combination with the other cancer drugs 5-fluorouracil and irinotecan and the adjuvant folinic acid. In August 27, 2014, EYNTK was also indicated for the treatment of patients with visual impairment due to diabetic macular edema, according to the updated summary of product characteristics. Contraindications: EYNTK is contraindicated in patients with infections or active inflammations of or near the eye, while Zaltrab has no contraindications. Adverse effects: Common adverse effects of the eye formulation include conjunctival hemorrhage, eye pain, cataract, vitreous detachment, floaters, and ocular hypertension. Zaltrab has adverse effects typical of anti-cancer drugs, such as reduced blood cell count, leukopenia, neutropenia, thrombocytopenia, gastrointestinal disorders like diarrhea and abdominal pain, and fatigue. Another common effect is hypertension, increased blood pressure. Interactions: No interactions are described for either formulation. Mechanism of action: In wet macular degeneration, abnormal blood vessels grow in the choriocapillaris, a layer of capillaries in the eye, leading to blood and protein leakage below the macula. Tumors need blood vessels sprouting into them when they become larger than a few millimeters, in order to get access to oxygen and nutritive substances to facilitate further growth. Aflibercept binds to circulating VEGFs and acts like a VEGF trap. It thereby inhibits the activity of the vascular endothelial growth factor subtypes VEGF-A and VEGF-B, as well as to placental growth factor, PGF, inhibiting the growth of new blood vessels in the choriocapillaris or the tumor, respectively. The aim of the cancer treatment, so to speak, is to starve the tumor. History: Regeneron commenced clinical testing of Aflibercept in cancer in 2001. In 2003, Regeneron signed a major deal with Aventis to develop Aflibercept in the field of cancer. In 2004, Regeneron started testing the compound, locally delivered, in proliferative eye diseases, and in 2006 Regeneron and Bayer signed an agreement to develop the eye indications. Clinical trials: In March 2011, Regeneron reported that Aflibercept failed its primary endpoint of overall survival in the VITAL Phase 3 trial for second-line treatment of locally advanced or metastatic non-small cell lung cancer, NSCLC, although it improved the secondary endpoint of progression-free survival. In April 2011, Regeneron reported that Aflibercept improved its primary endpoint of overall survival in the VALOR Phase 3 clinical trial for second-line treatment for metastatic colorectal cancer, mCRC. Aflibercept was also in a Phase 3 trial for hormone-refractory metastatic prostate cancer as of April 2011. A 2016 Cochrane review examined outcomes comparing Aflibercept versus ranibizumab injections in over 2,400 patients with neovascular AMD, from 2 randomized controlled trials. Both treatment options yielded similar improvements in visual acuity and morphological outcomes in patients, though the authors note that the Aflibercept treatment regimen has the potential to reduce treatment burden and other risks from injections. A 2017 review update studying the effects of anti-VEGF drugs on diabetic macular edema found that while all three studied treatments have advantages over laser therapy, there was moderate evidence that Aflibercept is significantly favored in all measured efficacy outcomes over ranibizumab and bevacizumab, after 1 year. Approvals. In November 2011, the United States Food and Drug Administration, FDA, approved Aflibercept, EYNTK, for the treatment of wet macular degeneration. On August 3, 2012, the FDA approved Aflibercept, Zaltrap, for use in combination with 5-fluorouracil, folinic acid, and irinotecan to treat adults with metastatic colorectal cancer that is resistant to or has progressed following an oxaliplatin-containing regimen. To avoid confusion with EYNTK, the FDA assigned a new name, Aflibercept, to the active ingredient. In November 2012, the European Medicines Agency, EMA, approved Aflibercept for the treatment of wet macular degeneration. On February 1, 2013, the European Commission granted a marketing authorization valid throughout the European Union for treatment of adults with metastatic colorectal cancer for whom treatment based on oxaliplatin has not worked or the cancer got worse, in combination with the other drugs mentioned above. Reimbursement. On March 12, 2015, Aflibercept was one of a group of drugs delisted from the UK Cancer Drugs Fund.
Please subscribe and thanks for watching.